I want to welcome a esteemed guest, somebody who I've just read about and was quite taken back by how remarkable he is. Can we welcome Professor David Roberts, who's the Interim Medical Director of Pathology in the NHS Blood and Transplant and Professor of Haematology at the University of Oxford. Can I ask him to come onto the stage?
I'm going to talk much more specifically about the Bangladesh UK work in health in my own field in blood diseases, and I would really like to thank many of the people who've contributed to this, some of whom will be known to you, and two people from Bangladesh, Sanjan Ras and Amin Aslam, have contributed greatly to the programme. I'd also say on a personal note, it's quite exciting to be here, not just because it's the start of a new phase in Bangladesh's history, but also I don't think I've ever been invited to a youth summit, and I thought I might be getting a bit too old for that, but there's always a first time. So thank you very much indeed. We've talked a lot about general principles, and it might be helpful to turn, I think, to some of the principles that have guided public health in global health, promulgated and devised by WHO almost 50 years ago, but I still think they're relevant. But really they probably apply to many initiatives in public services. And the first thing was that WHO set up a very ambitious aim, health for all, to move away from really segmented and very specific programs to have a really overarching aim. And they set out principles which I think are extremely relevant. And we've heard about some of them today in a wider political context. They were initially developed in the terms of health, that health should be equitable, appropriate, affordable, accountable and participatory. And that applies to health at all levels, where it's the village clinic, a small hospital, or indeed a national service. And WHO also emphasised that health policy should not come from outside. It should be determined by the citizens of the country. And I think that's really what we're going to see in the future. I'm going to just talk about some specific activities that have been going on in terms of health in my own field, blood diseases, but I do think that those, what I say, will probably be relevant to almost every speciality, whether it's surgery, obstetrics or paediatrics. There's been immense work in supporting clinical work in Bangladesh. Dr. Amin Aslam has set up a whole network of people to help support haematology by going to give lectures, and I've been over to Sylhet and Dhaka to lecture to the Bangladesh Society of Haematology. And Professor Islam also has set up teleconferences which have helped week to week and month to month support. We've also supported training of doctors who've come over on short-term exchanges. But clearly in the future, it's very important for Bangladesh to be self-sufficient in doctors, nurses and scientists support health services, and the secondary and university education, indeed postgraduate education, will I think be key for you. So we've also used some of our expertise to set up specific research projects, and we've tried to concentrate on areas that are of significant public health concern in Bangladesh. And I'm sure many of you will know families, if not even your own families, who've been touched by thalassemia, a genetic disease that requires, in its more severe forms, lifelong blood transfusion. And Professor Telford, who works very close to here in the Royal London Hospital, has set up with Dr. Zubair at the National Institute for Laboratory Medicine in Dhaka, a pilot project to screen neonates for this disease so they can be treated early. There may be much more ambitious programs to screen wide sections of the population and counsel them to try and prevent the disease, and that has been achieved in Cyprus and Iran. So really very significant changes in public health are achievable in this area. But I want to turn now to something that really is quite simple, and I think something you all know about, and that is my own area: blood. We all know blood saves lives. And I wonder how many of you are blood donors. Is there anyone who would like to volunteer being a blood donor? Yes, we have a few people. Well, that's fantastic. Great. I hope to see, that's fantastic. You can put your hands down. No more participation. I think it's a tremendously important part of healthcare, and I'm sure those of you who are blood donors will know how you actually feel better after doing it. And people have talked about the warm blood glow that blood donors have, knowing that their blood is going to help someone else. And the reason I speak about it now is really that you and the people who you'll be talking to will be the opinion formers in Bangladesh, and to get large sections of the population to donate blood. And we probably need, or you probably need, about 5 or 10 times as much blood as is being currently donated. You need to change opinion, and you need to change the culture. So I would urge all of you to learn about blood donation, to donate if you can, but to support those who do donate, and to follow the development of blood services. It certainly has to be organised and very competent to avoid further problems. And it's no good just having regulations. The regulations have to be implemented and monitored in a fair and thorough way. And we've already heard from Professor Hussain how good governance is the cornerstone of good public services. And I'm sure you'll all hear from other people about how different areas of the health service have to develop, perhaps surgery, obstetrics or cancer services, but none of these is really able to develop without blood. It's the foundation for much of hospital care. So I hope more will be developed. And I'd like to set the youth of Bangladesh, indeed all of you, not just the youth, a target, a slightly ambitious target perhaps: safe blood for all in Bangladesh by 2050. Well, I hope many of you working today will see that. Change happens slowly, but it is sure. And indeed, I hope I'm around to see it as well. So that is really a target I think you can achieve in Bangladesh. So in summary, this is a short talk, but I want to point out that there are many collaborations that can be developed. That blood is perhaps a simple, relatively straightforward, but important area of health services you could pay attention to. There are many good examples, and in developing it, you'll strengthen health services and strengthen community participation in health. I know also that there are many other ambitious programs to develop vaccine development, other therapeutic and diagnostics, and I'm sure these are achievable given the skills that you have and can draw on from around the world. But we mustn't forget what the WHO have laid out to develop services that are equitable, appropriate and affordable for all the population. And again, health services can only be changed by the citizens, and you're already making tremendous steps in that area. So just to finish then on safe blood for all, it's not just coming from outside. The students of Bangladesh are already promoting blood donation in universities. It's tremendously exciting to see that, and I hope in the future their work can be built on, be coordinated and deliver benefits for the whole population. Thank you.
Professor, thank you for that. Just before I let you go, just to summarize what you've done in terms of modernizing pathology and hematology in Bangladesh. Many hospitals in Bangladesh lack advanced pathology measures. So what national policy measures could be put in place to make them more effective, and how blood can reach, the pathology network can reach rural communities?
Well, that's a very good question. I think you have to have people, you have to have resources, and have to have knowledge. There has to be sufficient people trained. I think you have to draw on international advice and experience in terms of guidance and develop that for Bangladesh. I think one area that I have noticed in being in Bangladesh is that although lots of people are active in healthcare, in hospitals, often their work is relatively uncoordinated in the sense that there are very few national guidelines to follow. We have a whole series of national policy setting committees here, the National Institute for Clinical Excellence and also the Professional Society, so that area can be developed. And clearly it needs resources in terms and willpower in terms of government effort to develop health services for everyone.
And quickly, one last question before you go. From your experience working in the NHS, what policies can the next government of Bangladesh implement in ensuring there is voluntary blood donations and people have access to the right transplant operations?
Well, I think there has to be, again, the politic will to set up a national service. I think they have to encourage not just donation, but they have to give reassurance that the collections and testing are safe and the use of blood is entirely appropriate, so people have confidence and trust the blood services.
Let's hope so. Professor, thank you so much.